Bree. She's MD, FAAD, board certified pediatric dermatologist and clinical assistant professor of dermatology at Baylor College of Medicine and Texas Children's Hospital. She's also the executive director of a nonprofit organization, A Children's House for the Soul, which was formed to provide support for children and teens with skin conditions and birthmarks. As well, she is the owner and solo physician of a children's house for pediatric dermatology. Dr. Bree knows the true meaning of doing life together, belonging, purpose, and comfort. She has seen both my girls for skin issues and heals through her words of encouragement, prescribing medical treatment when needed. I have a daughter with many diagnoses who has allergic reactions and led us to seeing Dr. Bree at both her practices. My younger daughter was also in a horrific golf cart accident and developed keloids on her open wounds for years. We saw several doctors and treatments did not work. Finally, we were able to get in to see Dr. Bree. She asked my daughter a question I will never forget. Amanda, do you know where your beauty comes from? Amanda replied, yes, my mom and dad. Then Dr. Bree said, no, beauty comes from within. I've heard from doctors many times that they're very sorry for what our diagnosis and our families are going to do to our family. But I'll tell you that Dr. Bree's investment has given help to restore pain and loss for many and for our family as well. And I'm just honored to have you here today, Dr. Bree.
Oh, you made me cry. I love you. Thank you. It's a privilege. I consider my job a privilege and a blessing. So thank you. Thank you for letting me take care of your girls.
Of course.
Yay.
Okay.
All right. So, all right. Now I'll let my chairs dry a second, and then we're going to jump right on in. So I just press share screen to get going. Is that right?
Yes.
All right. Yeah. Thank you. Thank you, Jenny.
You're welcome.
All right, here we go. Share screen. Can everybody see the screen?
Yes.
Okay, perfect. All right, so we're going to jump right on into this empowerment series, and I hope everybody that's listening now or in the future will be empowered by these words. So today my talk is called Love the Skin You're In, and that's really the message that I like to share in my professional life and also in my personal life. So let's see here. Maybe I should have practiced advanced. Oh, there we go. Advanced. Good deal. So thank you for the invitation to speak, of course, Jenny. I appreciate that. And I may be a double board certified physician, but people tease me that I really want to be a motivational speaker. Not really, but I guess maybe sort of. Fortunately, though, we have the opportunity to be the authors of our own unique story. And I look at my life as kind of a choose your own adventure book, right? Sometimes the chapters are good. Sometimes you wish that the chapters would end. But life is in some ways a choose your own adventure book, and I like to look at it like that. So this is a book that I initially wrote, and the Illustrated Manual of Pediatric Dermatology, but recently I published this book, and this is a really important part of my life, and I finally know what I want to be when I grow up. It is a pediatric dermatologist at a Children's House for the Soul and a Children's House for Pediatric Dermatology. So our mission here is to provide exceptional pediatric dermatology care and an extraordinary patient experience that exceeds expectations. So I luckily get to come to this cute little house every day. It's bright and cheery, and you can't be sad when you come into this bright orange door to all these bright colors. So this is where I luckily get to practice, and I luckily get to do what I love. I really love what I get to do. I think the skin is like artwork. There's patterns and textures and colors, and it just fascinates me. And it's also beautiful to me. So skin, hair, and nails, it's all formed from the ectoderm. When we're an infant being formed, it's the largest organ of the body. It makes up 16% of your weight. And the reason we have skin is to keep good things in and bad things out. And it's really an important organ in the fact that if you didn't have skin, you couldn't survive, but it works together with all your other organs, of course. And we do lose about 1 million skin cells a day and 100 hairs a day. It's the most active organ that we have. So I have the unique privilege of being one of 326 board-certified pediatric dermatologists in the US. As a pediatric dermatologist, I get to provide specialized care for infants, children, adolescents, and teens in the diagnosis and management of these conditions. There are many, many common conditions that can be treated very successfully, but there are many rare conditions that may not have a cure and may have very limited treatment options. And then one thing that I do want to just bring out, there are a lot of children that I take care of that have rare conditions, but common things do happen commonly, and they even happen commonly in rare conditions. So even if your child has a rare undiagnosed condition, they still will have common things happen to them. And not everything is going to be explained by the underlying condition. So the first one we're going to start with here is acne. Acne can rarely be a sign of a hormonal problem when it develops in a young child, but we found in a study that I did when I was a resident, actually, that they will always have other advanced signs of puberty. So they'll have early development of hair under the armpits, they'll have pubic hair, body odor, those kind of things. So if you see that in a child that has early acne, then it's cause for more of a workup. But if you just see acne in a young child, you actually don't have to be too alarmed. A few tips here, non-comedogenic products, and this is for anybody that has acne, children, teens, or adults, and you just want to look at all the packaging and make sure it says non-comedogenic. Certainly don't pick your face. It's one thing that it's hard as a dermatologist. I sometimes want to myself, but it definitely leaves dark marks on your skin. Diet modifications. As far as diet goes, they've done a lot of studies, and it's really been variable, and what they've found can make an impact. It's hard to do a good diet study, but they have found people that had high sugar diets have more acne, and people that actually drink skim milk can have acne. Then also just don't over scrub or use too harsh of astringents. That can be difficult. And then over-the-counter products with salicylic acid and benzoyl peroxide for teens and adults, but children are not going to tolerate these. All right, this is probably the most common condition that I see, eczema. And eczema is also called atopic dermatitis. They're interchangeable words. Eczema has gotten more and more common, and the thought of this is that we don't have many infections anymore, and our immune system is kind of bored, so it overreacts to things that it shouldn't. And that's why we think that eczema, asthma, allergies, all of these things are on the rise, autoimmune diseases, because in countries that still have significant infections, they don't have nearly as many of these autoinflammatory issues. So eczema is associated with asthma and food allergies, but they're not causative of one another. There's no cure for eczema, but it does improve with age, thankfully. And they've shown that in 85% of cases, by 8 it will be gone, and then by 20, 95% of cases will be gone. Really important to take good care of the skin, of course. Daily bathing, there's some variation in what people tell you to do out there, but the daily bathing has really been shown to be helpful if you do it correctly. It hydrates the skin, it removes irritants, infections. You want to use warm water, but not hot, of course. 20 minutes or less, but you can let your children play in the bathtub and have a good time if they have eczema. Just kind of do the soaps and things at the end, so they're not sitting in those, to let them play first and then clean them. And a little bit of mild soap is good, just to kind of get the irritants and infection-causing things off of the skin. Then just get out. The most important part is the 3-minute rule, where you pat dry and you apply a moisturizer within 3 minutes. As far as products that are out there, I have to tell you, many things that are even marketed for eczema can be very irritating. There's a lot of potential allergens. Neosporin is something I would encourage people to avoid using. About 20% of people are allergic to neomycin and neosporin. I do like Vanny Cream products. It's probably my favorite product line. It has less of the stuff that people can react to. Parabens, dyes, fragrance, all of those are removed from the Vanny Cream products. You can get those on Amazon. You can get it at Target, CVS, Walmart as well. Definitely, this is an itchy condition. You can see this sweet little boy here in the picture. He is obviously very itchy, and that becomes a behavioral component. Unfortunately, these children put themselves to bed scratching, so then that becomes their security blanket, so that any time that then they're in a stressful situation, upset, mad, they don't get their way in a new environment, they tend to scratch. And then that, we call eczema the itch that rashes, that brings up the eczema. So it's good to keep the nails trimmed short, and as they get a little older, you can do behavior modification techniques, but cool compresses or chilled moisturizers to the itchy area do calm that down as well. Impetigo, this is also a very common skin problem that you may see in your children. It's common in children, more common in children with eczema and in athletes. It's due to staph bacteria, which is very, very common in our environment. And yeah, there's a lot of bad cases of potential staph, but most cases of staph are not harmful. They'll cause skin problems, but they can be treated well. The very classic picture is this little picture here, where you have what we call these honey color crusts. You can have blistering though with impetigo and pus bumps that develop. Ways to decrease recurrences. I know this sounds crazy, but dilute bleach baths, we call them swimming pool baths. Those are actually very excellent for helping reduce recurrences, and just doing that a couple times a week. There is chlorhexidine, which also goes by Hibiclens over the counter. You don't need a prescription, but it does have dye. It's a pink color. So some children that are allergic to dyes can react to that. And then CLN cleanser, you can get that online. And that's also very helpful for reducing staph on the skin. This diagnosis seems to have taken over the world, certainly the world of pediatric dermatologists, I can tell you. Molluscum is the new version of chickenpox for this young generation. It's caused by a pox virus. And basically, when we started vaccinating for chickenpox, then this molluscum, which was a opportunistic infection and just affected people that were immunosuppressed, then took the opportunity to kind of take over the place of chickenpox. It is contagious, but the virus is everywhere. It can survive in swimming pool water even, which is kind of crazy. Luckily, the cases are not typically very severe, but some children do develop hundreds of lesions, especially if immunosuppressed. Rarely it results in scarring because it is a pox virus. On average, you don't have to do anything. And on average, it will take about 2 years for this to go away fully. And unfortunately, there's no FDA-approved treatments currently, but there are some options, over-the-counter options that work really well. Apple cider vinegar, believe it or not, is very, very effective for this. It does cause irritation. All the topical products that you apply, that you put on the skin here that I'm listing, will cause some degree of irritation, and it stimulates the body's immune response to come fight this little virus. There are other things that you can do in the office. If it is troublesome, you can see a pediatric dermatologist for it. But apple cider vinegar, a recent study showed that lemon myrtle oil was effective. Zymoderm, which is basically kind of like iodine. Conzerol is from the bark of a tree, and I have a little patient that calls it chocolate chip medicine because it causes the little spots to get real dark and crusty. And then tea tree oil, which tends to be probably the most irritating of all of these, but it can be effective. Moles. I see a lot of kids for moles. Luckily, the risk of moles is very small. It's due to benign pigment cells that collect in the skin. There are many environmental and genetic components. They are more common in sun-exposed areas, but you can get them in areas where the sun doesn't shine. Kids that grow up in sunnier states actually have more moles than kids that grow up in northern states. And there is a very small increased risk of melanoma development. Luckily, that risk is way less than 1% in small moles. It is really important to check your skin though. Check for the ABCDs, and you can find that online, but asymmetry, border, color, diameter, and every little change or evolving is what the E stands for. So basically a changing mole in size, shape, color. They should grow in proportion to your child's growth, so they are going to grow and stretch with them. But they shouldn't be bothersome. They shouldn't bleed. They shouldn't itch. If they do, you should definitely get those checked out. And then, of course, as a dermatologist, I have to recommend sun protection because it is so important. It really is. It's been shown to reduce the risk of skin cancers. And we know that UV is considered a carcinogen. So it's silly to expose yourself to a carcinogen if you don't need to. And vitamin D, yes, the sun does help with vitamin D, but there's safe ways to get vitamin D intake. And a little bit of sun exposure, just like anything, is not going to hurt you. It's all things in moderation. But limiting during the peak hours, and then certainly applying a sunblock and reapplying if you're active in the sun. And the most important thing, a lot of people think the SPF is really important, which it is, but what's more important is the active ingredient. So you really want to have zinc or titanium dioxide as the active ingredient. The other thing about the sun is it really can induce skin cancers. So basal cells and squamous cells, those are very common. 1 in 4 people are actually going to develop a basal cell, and those are all sun-induced. But the one that we really want to be on the lookout for is melanoma, because that is a much more serious diagnosis. Luckily, it's still pretty rare, but 1 in 34 Americans now have a lifetime risk of developing a melanoma. It is the second most common cancer in adolescents than young adults. It's a primary cause of cancer death in young women 25 to 30. So it's something that we can prevent and we can take steps to limit. And it also has a great prognosis if caught early. So that's what's so important. That's why that monthly skin check, and I tell people if you have a dog, on the day you give your heartworm medicine to your dog is a good day for the skin checks. I put that on the first of the month in our household. So check your skin monthly. And then certainly always follow up if you have concerns. It's always better to get something checked out and biopsied early and treated if need be. Because there's no reason for that to be something that harms you. All right, and as we know, so this is the part that's kind of near and dear to my heart. While I like to take care of the physical aspects of skin disease, and I really love the job that I do, what I really like the best is addressing these issues that are more than skin deep. So 2 out of 5 children with a chronic skin condition have some psychosocial impairment, either social withdrawal, lack of confidence, depression. And this is sadly not surprising because Americans spend more on their appearance than on health and education combined, which is crazy to me. Our society is one that values these aesthetic and beautiful, standards that are out there, but that unfortunately leads to social stigma and alienation of children with skin conditions and people with skin conditions. So unfortunately, these children see people's reactions, internalize those, and they often suffer from a lifetime of body image and low self-esteem. So what I really love about my job, and these are all heart-shaped lesions, I published a little study or a little manuscript actually with heart-shaped lesions that I collected over the years, and it was published on Valentine's Day a few years back, and you can see these little skin heart lesions, which I love. I told you I love the skin. I am a dermatology nerd, but I also love addressing the social, emotional, and spiritual aspects of skin disease because I think that's the most important part for a lot of these children. I always say it's really easy for me to write a prescription or do a laser treatment, but what's really more important for me to do is to sit down and to know these kids and to talk to them about how it really truly impacts them. So because of my love for that and my passion for that, I've started a nonprofit as well, and our mission is to encourage and unite children and their families who are affected by skin disease and birthmarks by providing opportunities for social, emotional, and spiritual support. It's called the Children's House for the Soul, and it's very close to my soul. And I actually realized the need for this as a resident. Early on in my training, I started volunteering for Camp Discovery, and that's supported through the American Academy of Dermatology, and I can't say enough good things about this camp. Their motto is changing life through life-changing experiences, and I can tell you that I've seen many lives change through Camp Discovery. And it is really where I saw these kids go off to camp and really come alive. When they connect with other people, they realize they're not alone. Sometimes it's the first time they've met someone else with their diagnosis, or even that understands what it's like to be looked at, stared at, made fun of, bullied. So these kids, we call it turbo bonding. They become best of friends. And I've seen lots of kids grow up through the camp program, and it really does change their lives. So that's kind of what stimulated me to start the nonprofit to support children, not just for this week of camp, but throughout the year. So camp definitely provides a new perspective, and we're going to touch a little bit about some more rare conditions that affect the skin, but kind of through the lens of camp. So on the surface is what we see, but under the surface, that's what, sometimes we don't see, but it's even more important. So on the surface, Camp Discovery provides children with chronic significant skin disorders an opportunity to experience camp and support others in a setting of acceptance, love, and fun. This was written by Mandy Moore, and she was just really awesome in, she was a camp counselor, she's a dermatologist now, but she wrote this great article in the Journal of the American Academy of Dermatology, and she wrote, campers slip out of skin that in the outside world cause them nothing but fear and pain, isolation and rejection. But ugliness evaporates at camp. Campers sometimes forget, I am told, that they are different. For a fleeting week, they leave a cruel world behind, a world that judges from the outside in. And again, I can tell you, I've seen so many kids come alive at camp. So here is Curtis. And Curtis, on the surface, you can see a camper with vitiligo. And that's an autoinflammatory condition of unknown cause that leads to patches of skin without pigment, as well as white hair in the affected areas. But under the surface, Curtis is a sweet young man who's outgoing, and he really he's becoming a teenager, but he was a bit of a ham and really let his personality shine at camp. But now he is an amazing teenager and a basketball player, and he wants to play for the NBA. And I think he's got the abilities. So on the surface, you may see a camper with albinism, and that causes diffusely light skin. It's a genetic skin disease that has limited pigment in the skin, which increases the risk of skin cancers and can lead to vision issues that lead to legal blindness. But here, under the surface, Hope is a quiet but inquisitive young lady who really opened up at camp, and she wants to be a doctor. And I can tell you, she quizzed me about the genetics of albinism and asked me questions that I was hard-pressed to answer, actually. She's a very bright young girl. So on the surface here, you can see a camper with severe eczema, also known as atopic dermatitis, like we talked about. It's associated with food allergies and environmental allergies, and also asthma. And this, unfortunately, limited Luke's ability to participate in many things. But Luke's a really great kid, and under the surface, he was so excited to finally meet others at camp who truly understand how he feels. And he's been a speaker at some of our events now that he's a little older, and he's just a fine young man that I'm honored to know. On the surface, you may see a camper with autoimmune condition that causes complete hair loss, involving loss of the scalp hair, eyebrows, eyelashes, and this is known as alopecia universalis. Again, of unknown cause, can be associated with other autoimmune conditions. But under the surface, Adriana is a kind, caring young woman, and her smile really can light up a room, as you can see here. So on the surface, you may see a camper with an extensive birthmark. It's known as a giant congenital nevus, and it has a high risk of melanoma development, and unfortunately has neurologic involvement that can require neurosurgery. But under the surface, this is Houston, and he really is one of the most wonderful kids I've ever had the pleasure of meeting. And everybody loves him, I have to say. And he told me, he pulled me aside a few years ago and just told me that camp has really just changed his life, and he's just so thankful for what it's given him. So on the surface, you can see a camper with ichthyosis, and that is also a genetic skin condition that causes thickened and scaly skin that's also very sensitive and at risk for skin breakdown. And because it is genetic, it is a chronic condition. A lot of children with ichthyosis are quite shy just because of their skin disorder. I've noticed it's one where they're a little bit more quiet. It can affect the vision in the eyes as well. And Jessica was like many of the kids, very quiet when she came in, but she finally, thankfully, became comfortable in her own skin during camp. So on the surface, and all these kids, it's just great to see these pictures, I have to tell you. You'll see a camper with ectodermal dysplasia that have this condition is a genetic condition that affects your ectoderm, which makes your hair, nails, sweat glands. So the classic features of this are decreased hair, very few teeth that are pointy, and an inability to sweat due to lack of sweat glands, which can lead to fevers as an infant and also febrile seizures. But under the surface, Wade is a shy, quiet child, but he really came out of his shell at camp, as you can see here with one of his camp counselors. He had a great time and made many lifelong friends. So on the surface here, you will see a young camper who has epidermal nevus syndrome, and our epidermis is the top layer of our skin, and this is a type of birthmark that covers, it can cover small areas of the skin or be really extensive and cover all the skin surface. Can be associated with other issues of the brain, eye, and skeletal system, as well as the heart. But I have to tell you, Christina, under the surface, she is a young lady who is one of the most poised people I've ever met, and she plans to be a professional dancer and actress, and I believe she can do it. And then here you may see a camper with a rare genetic skin condition called keratitis, ichthyosis, and deafness. And this little girl is almost blind and is fully deaf. But under the surface, Monique evolved so much here, and you can see her smile after ziplining, which was, of course, priceless. Doing something that you think you might not be able to otherwise do. It's quite exhilarating. And this is Jamie. He has a rare and severe form of epidermolysis bullosa on the skin surface. It causes blistering, and these kiddos tend to have to be wrapped. You can see he's wrapped here with dressings from kind of head to toe. But he never complained, and he was such an inspiration to many, and he was such a great fisherman too. He had tons of patience, and he won the most fish caught award at camp. And here's Kyle. He's a camper. He also has epidermolysis bullosa that has, very significant skin fragility, but he didn't let his disease define what he can and cannot do, and I think that's so important. So, so important. And here's a young woman who attended camp with epidermolysis bullosa. And you can see here, she's kind of got scarring on her hands. There's so much scarring that develops that they lose their fingers and toes to the scarring. It's called mitten hand deformity. But despite that, you can see here, she made it to the top of the wall and just has that sense of accomplishment that she might not have ever felt before she came to camp. So on the surface, these are some very sweet girls who are now teenagers. And again, I love looking at these pictures. But Juliana and Amy, they have a condition called xeroderma pigmentosa. Sometimes this is called midnight children because they have extreme sun sensitivity and risk for skin cancers. So it requires them to be covered in these kind of what looks like almost like beekeeper suits whenever they're in the sun. But at our camp, we do have a specifically designed indoor track with nighttime activities so they can fully experience the camp experience. And then this young woman, this is actually her dermatologist who defined the gene of her condition, which is just awesome. And they came out to camp together because Desiree was really troubled by her skin involvement and what it looked like to other people. She has pseudoxanthoma elasticum, which can affect not only the skin, but also the eyes and blood vessels. But when she came out to camp, she realized that people were significantly more affected by her. And it really did give her a new perspective, which we see a lot of times in our campers. And then this is Rachel. I actually sent her a picture of this last night. She is now studied to be a child life specialist. And she really was one of my best teachers. So the great thing about camp is it not only positively impacts the kids, but we have medical professionals that come out and it's life-changing for them as well. So of course, I've learned a lot through textbooks, but I've learned a lot more. And I will tell you, Rachel taught me how to do dressing changes better than any textbook or any professor that I've ever had. So here's just a few lessons. I do talk to not only families a lot, but I do talk to medical professionals about the impacts of camp and addressing these issues for their patients. And these are just a few lessons I think that are important to share that I learned during my time at camp. So lesson 1, a child with a skin disorder, or any disorder for that matter, is not defined by that disorder. Each child is special and unique, and they have thoughts, hopes, and dreams that are fully independent of their medical issues. Lesson 2, doctors and nurses don't always know best. And this is a hard pill to swallow as a medical professional sometimes, but children and their families often know more than their doctors and nurses about their own unique conditions. And they certainly know what it's like to live in their skin and what special challenges it can present. So I think it's really important to have a partnership between a patient, the family, and the physicians for the best care. And then lesson 3, a positive attitude will get you far. And this, is obvious, but it really, when I go out to camp, the positive attitudes of these kids, learning to cope with their difference, is just really inspiring. And it puts a smile to my face. Lesson 4, be a good listener and friend. So again, just remembering that children with any kind of disorder are simply children. They want to have someone truly listen to them and what they have to say. And I think it's really important as healthcare providers that we talk with our patients about other things than just their medical issues. And I think too, as parents and caregivers, sometimes we get so focused, and I have children of my own with medical issues and learning issues, and sometimes we get so laser focused on taking care that we sometimes forget that care involves all the other aspects, not just what we see. Lesson 5, don't underestimate the power of touch. And I think this is so important. These children and adolescents endure daily stares from others, and that's something that we can't change. They're different from their peers and they know it, and I think it's just really important to affirm them by placing your hand on their skin and letting them know that you see them and you accept them, and it really does help momentarily erase the differences. So I think the power of touch, we can't forget that. Other lessons I've learned along the journey, embrace your faith. This is so important to me, and I feel like if I didn't talk about this in a talk, I would not be doing my duty, because it's such a source of strength for me. I think it helps people to focus outside of themselves and gives us a different heavenly perspective. And I also believe that we're each God's unique masterpiece, and I think that's really important to remember. If we frame things in that way, it makes life a lot better. And I do a lot of mission work. I've been to lots and lots of different countries, and I can tell you that people around the world are more similar than they are different. We all need love, and we all desire acceptance. And I also want to encourage people to not compare themselves or their issues, their children's issues, to anyone else. It does steal your joy. So try not to compare your goods or your bad with other people. Oh, this kind of got out of order here, but your words and actions are powerful, and they have impact on you and others, and I think that's really important. So choose to make your words positive and practice gratitude. I think it's really important. There are some days that you just do not feel grateful for anything, and that's okay, but make it a practice of trying to write down a few things that you're grateful for, even if it's just that clean water came out of my sink. I didn't have to walk to a river to get water that's not safe, or I have a roof over my head, or I had a car that started so that I could go to the grocery store. So anyway, even just really small things, I think when we practice that, it changes our perspective, and it really does become a habit then. And then I think connecting with others is just so powerful. Collaboration really just helps us learn and grow. I think it's really important to learn to talk less and to listen more. And then giving of yourself, of course, brings true contentment. So always trying to give, even when you feel like maybe you don't have much to give. And then learning to truly love the skin you're in. I think this is my message, and this is why you will never see me personally do Botox, and why I don't wear much makeup, because I think the message out there is that we need to do things to ourselves to make ourselves look better. And I'm not saying don't take care of yourself and put your best face forward, but I think focusing on the external beauty is really not important. So embracing who you are. We all have differences. We all have challenges. We are all unique, and that's what makes the world a beautiful place. And as Jenny mentioned, I really have truly believe that beauty is much more than skin deep. Let who you are shine out from the inside as a source of your true beauty. And I can tell you, I see lots of kids who might otherwise be seen for their skin condition, but they have an inner strength, which has been built up by the people that love them. And it shines out more than anything you would see on their skin. And now I'm making myself cry because I'm thinking of several of these lovely kids that just shine. I'm sorry. I love what I do. And when you truly love and accept who you are, you will find that others love and accept you too. So don't let anyone else define you. Don't give them permission. And while I know sometimes we're out there seeking a diagnosis, and that can give comfort, don't ever forget that your child's not a diagnosis anyway. That's not the goal. The goal is to raise them up and support them. And yes, sometimes I think having a diagnosis is helpful for some things, but it doesn't change the fact that you have been gifted a beautiful child. And sometimes not having a diagnosis is okay, because you know they're yours, and that's not going to change. So I have a great friend, Rick Gudaudy, of Positive Exposure. If you have never gone to his website, Positive Exposure, he's a fashion photographer out of New York, and I cannot say enough good things about him. He's got a great coffee table book called Change the Way You See the Way You Change. And he takes pictures of children with differences. So he used to be a fashion photographer from New York, and he realized that true beauty comes from the inside too. And he has a great way of capturing that. So he started taking pictures of people with albinism, and then branched out and really takes pictures of kids with all kinds of differences now, kids and adults. He goes to many genetic conferences, and again, I can't say enough good things about Rick and the work that he does, and helping change the world and how they see things. So changing the world one person at a time is, I think, what our mission is. We can only affect, the people that we come in contact with, but we all come in contact with so many people, and looking at those as golden opportunities to make the world a better place, I think, gives us, again, good perspective. So give grace to yourself, and also give it to other people. You want people to give you grace, but you have to remember you have to give it to others. even when it seems like it's not deserved. Skin changes and medical conditions can sometimes be obvious to others. And people who stare and ask questions, I found most of the time are just typically curious and they're not quite sure how to respond. And most people are not negative. There are some people, yes, that are gonna say hurtful things, and those people you just have to walk away from. But most people just really want to know and understand. So take a deep breath and approach it as positively as possible. My kids used to get sick of me. My saying was PMA all the way, positive mental attitude. So look at it as a chance to teach somebody else about living with a rare disorder. I think it's good to have a prepared response, and if your children are older and can speak for themselves, I think it's good to practice a response with them because they will be put in these situations, and it's always better to have a practice response. And I also think some days you're just not on. Some days you are tired and you're done with it, and you don't want to give an explanation to anyone, even if it is a golden opportunity. So I think these business cards, some people call them mind your own business cards, but I think that's negative. So, you know, an advocacy card, whatever you want to call it, but you can just print small little business size cards and just say, I see you're interested in my or my child's condition when they're staring. If you want to learn more, and you can put the website for CC4C, and then you can put on the back, if you want to help, you can make a donation to help us find answers. And I think this is a positive way to address it when people are staring, and it also then raises awareness for things that are dear to your heart as well. And then some other useful tips that I've kind of found over the years that can be helpful. We definitely need to be our own best advocate, our children's best advocate, but do remember that even though you might be frustrated, addressing it positively with the people in your life are going to get you further than being really aggressive in what you need. And a lot of times you'll get what you want better if you address it in a kind way. I do see this, unfortunately, in my practice, where families will come in and speak very negatively about their children's condition in front of their own child, about how this is so terrible and so awful. And I see this happen all the time. And of course, those children are going to believe that. They hear their parents talking about it. So please be careful when you talk in front of your children what you say, because they do hear it, and it might be when you're on the phone in the car. Just be careful what you say, because words are powerful. Also, physicians, find physicians and care providers who you like. They really do need to be your partner, and I'm going to tell you, there are not many experts out there in rare diseases, so you're not going to be going to the expert always. It's great if you can connect with an expert, but if you can't, really just find somebody who wants to learn and is interested. And most physicians do fit that bill, I think, and most do try their best for the most part, and they're human with limitations too, so try to be understanding and patient with them, and realize that you are going to know your child's condition better than anyone. I know that's frustrating when you sometimes have to go in and explain what it is, but again, try and frame it as a golden opportunity, and just find those people that really do want to learn and partner with you in your children's care. And I think that's better than having an expert any day, having somebody that truly cares about your child, providing them care. Certainly develop a good network. You guys are doing that with your involvement here with this group. But I think it's also important to find someone you can vent to outside of your house. And I think this is important not just for kids with chronic issues, but you know, you don't always want to be going to your spouse or your loved one venting, because it drags them down too, and we want to boost each other up. So certainly have a pity party when you really need it, but if you make it a habit, you're going to wire your brain to have a pity party more often. So you got to wire your brain positively. So throw that pity party, then get back up off the floor and do what you need to do, and find other people to connect with. Don't be afraid to ask for help. There are plenty of people out there that want to help. Just reach out to other people in your spheres of influence. Other parents with children who have medical conditions are great resources. And then realize you're never alone. You may feel very alone, but there are other people out there you can connect with, and certainly CC4C is a great group, and there's other support organizations. So never stray far from those, and always lean on them when you need them, but also be willing to give to others when they need it too. So I think as a parent, this was really important to me, and I actually, as a parent of a teen and a young adult, This applies, I think, even more so sometimes. It's a saying by Corrie ten Boom, who lived through Nazi concentration camps, and this is so important, and I've had this up on my desk a lot over the years. Worry does not empty tomorrow of its sorrow. It empties today of its strength. So try not to worry. Worry is not going to change the final outcome. It's really just going to zap you of your strength and energy. So focus on the things that you can make a difference with. Put one foot in front of the other, and don't worry about what tomorrow is going to bring, because it will be here and it will have its issues, but you will address them and you'll have more strength. So just be the best self you can be in the moment with the resources you have at the time, and don't beat yourself up on the days you're not on, because we're not going to be on every day. And then this just ends my talk here with a quote. Again, I do a lot of mission work, and I take care of children with albinism in Tanzania, who are near and dear to my heart. And this is a saying in Swahili, leo ni leo. It means today is the day, and I wear a necklace that actually says it. Today is the day. So today is the day to get up and to make a difference and let your light shine before others. So I thank you for your time and attention. I hope I've empowered you. I hope some of my words will make a difference or in your life and in the life of your children. And I'm just so thankful to be able to spend this time with you guys here today. Thank you.
Thank you.
Thank you so much, Dr. Bree. Could maybe we open up for questions for a couple of minutes, or do you need to jump off?
Nope, I'm actually good. If people have any questions right now, I am happy to answer them.
I have one actually. Dr. Bree, this is Shelly, Mila's mom.
Yeah.
First of all, thank you so much for your time. You are such like a positive energy. I just love you so much. But I have I have a couple questions about the camp. So do you have to have a skin disorder to go there? So I love the term that you used, turbo bonding. My daughter Mila has a rare genetic disorder, and she is legally blind and has microcephaly.
Okay.
She is cognitively developing normally, which is just, we're very grateful. Yes. But she goes to camp with a lot of the same kiddos that we saw on your slides, like the albinism kids and some of the kids that are legally blind. And so she goes to school here in Austin, or I'm sorry, goes to camp here in Austin at TSBVI, the Texas School for the Blind. And I have noticed also the turbo bonding, like it's just wonderful to finally meet somebody like you. And I'm just wondering if there are other kiddos that are allowed to attend Camp Discovery, or is it just for skin disorders?
So Camp Discovery specifically is for skin disorders.
Okay.
It's through the American Academy of Dermatology, so paid for by dermatologists. As far as, getting nominated, if there is any skin issue, you can be nominated. You just have to be nominated by a board certified dermatologist. They turn in an application that's free of charge to attend. But we go to Camp for All. Have you ever heard of Camp for All?
I have actually. I do that. Is it a weekly thing? My mother-in-law used to work for the what is it called when you have seizures?
Epilepsy.
Epilepsy Foundation. Thank you. And so they did Camp for All, and I think, do they change weekly? Like what type of?
They do. Yep. So exactly. But Camp for All, it's in Burton, Texas, and it's for kids and adults with medical issues, and they kind of have rotating. And if you go to their website, you'll see their partner camps. She might fit in some of the other partner camps.
Sure. Okay.
And we do a weekend camp there as well. We do a week-long camp, but then also a weekend camp. And the group that you're connected with may be able to go out, and it's just really great for them to really do something different out of their comfort zone, because it really does challenge them. And we had a little girl that was wheelchair bound because of her skin disorder, and it's a barrier-free camp, so they make sure these kids can do anything they want. And they got this little girl up in the heart, still got to do the zip line. So it truly is a barrier-free camp. I can't say enough good things about Camp for All.
Okay, great.
Yeah, and we share our week with kids with sickle cell disease, and then renal disease. They actually do dialysis out at camp for the kids with kidney disease.
Wow.
So it's a spectacular medical facility. But yeah, campforall.org, I think, is their website, and you can see their partners. And the groups that you're involved with, you can even do a weekend camp out there. And it's very expensive, and it's just fun to take, even if it's the same kids that your family's been with.
Sure.
Just to go out and do something different together is exhilarating.
Okay. Wonderful. Thank you.
Yeah, Yeah, of course. Of course. I'm so glad that you joined today.
Yes, thank you. I am too.
Hey. I think we have a small group today, but hopefully it'll touch lots of people online, right?
Mm-hmm.
Yes, and since it's recorded, we'll send it out to all our families.
Awesome.
So we were also wondering if you might share with us maybe a couple takeaways for optimal skin health for parents that you might recommend. I know you said, not too much, but just like your 3 favorite products or.
Yeah, so of course, I think the best beauty tip and beauty secret is to have a smile on your face, but that's not skin related. But as far as the best beauty secret for your skin, it's sun protection. Daily sun protection is so important. And again, SPF isn't all that important. As long as you get an SPF of 30, you don't have to go much above that. And then you don't want all the chemical in your sunscreen. So when you look at the active ingredient, you want it to say zinc oxide or titanium dioxide. And those are the 2 active ingredients that you want in your sunscreen. And then make sure you get your face. If your ears stick out, there's a lot of people that get skin cancers on their ears, so get your ears. And then aging really does happen a lot on our neck, so get your neck, and also the backs of our hands. And sun and UV does come in through windows and when we're driving. So it's important just to make that part of your daily skincare habit, like in the morning, brush your teeth, wash your face, get your sunscreen on. So that's probably the biggest tip. And then as far as products, really the only product line I recommend is the Vanny Cream product line. And it was formulated at Mayo Clinic by their dermatologist there. And that's the only place you could get it. They sold it to a real small pharmacy and out of Minnesota, but now you can get it on Amazon. You can get it on, again, Target, Walmart, CVS, Walgreens. And then you can also order it online through their website. But I think their products, they just don't have parabens, dyes, fragrance, lanolin, a lot of things that people react to and that are also just not good for our skin. So sticking with the Vanny Cream product line, I think is a good recommendation. And then certainly if you see anything changing on your skin, it's always better to get it checked out by a board certified dermatologist. Don't let it sit around. Adults should not be making new moles after the age of 40. So kids are gonna make, on average, people have 40 moles. And they're going to come kind of when kids go through growth spurts. So around preschool, kids tend to get a lot of moles, and around puberty. But after 40, you may make new brown spots, age spots, sunspots, those kind of things. But you shouldn't be making new moles. So any brown spot, especially, or even a red melanoma, can come up as a pink bump that bleeds. So certainly anything that comes up quickly and is just changing, get it checked out. Don't let it sit around. Because again, if it is something bad, it's better to address it early and get it taken care of. And then hydrate your skin, treat it well. Your skin has a memory, so it remembers the sun, and remember, all the bad exposures. So keep our skin barrier, keep it as healthy as possible, keep it hydrated and sun protected.
Thank you so much. This is very helpful. We need all the reminders as parents, and
yes, because as caregivers,
take care of ourselves because we're worrying about our children, which I know we shouldn't.
No worrying is not allowed, but it is good. Yeah, you have to keep yourself boosted up as the caregiver, because it's hard to. So yep, don't forget about yourself.
Thank you so much. Thank you so much for your time.
Yes, you bet.
So grateful you could join us today.
Yes, me too. It's been a blessing. Thank you so much for the invitation.
May we give your website to everyone, and maybe your email if they had questions, or what? Of course. Okay, how to contact you.
So, it's achildrenshouse.com is my practice website. achildrenshouse.org is my nonprofit. And then it's Dr. Bree, DRBREE, at achildrenshouse.com. And that's also on my website. So if you go to providers, you can click right on a link and email me from there too. So it's on my website too.
Thank you so much.
You bet. Well, thank you so much.
Maria?
Yes, Maria. Thank you so much, everybody. I'm going to end the session right now. Have a good day.
Thank you. You too. Be blessed.
Bye-bye.
Bye-bye.
Bye-bye.